Today I talked about the provisions of the Affordable Care Act that will really help patients get better access to coverage, adequate coverage that will be there for the services they need, and more affordable coverage. But we also know that there are potential areas where patients will face problems, that some of the protections will not play out as fully intended. For example, the maximum out-of-pocket limits come with some caveats that patients might not be aware of. So we really want to understand going forward how the benefits are working for people who enroll in exchange coverage. Can they see the doctor of their choice? Can they get their coverage, their health care paid for? Are they being protected by the out-of-pocket limit, or are they incurring costs that don't accrue to that limit? How are they benefiting from this new coverage? I think the biggest challenge is really capturing that patient experience. We talked a lot about this, and I think this is a broadly shared concern. So now they're enrolled. That was the big goal with open enrollment, was to get more people coverage. But my fellow panelists really talked about, does that mean having coverage means you're accessing care? And we don't know that yet. And I think that's something we need to understand so we can advocate for improvements, whatever it may be, in adequacy or access or affordability. But capturing that experience is going to be difficult. Surveys are complicated and take time. Finding the patients and understanding their experience is going to be challenging, but I think it's worth doing so we know where the problems are and can advocate to fix them. Well, certainly there are opportunities at the state level. As I said in my presentation, the Affordable Care Act sets a floor for consumer protections, but in all cases, states can enact protections that go further and provide more protections for consumers. So advocates could certainly work at the state level to make protections stronger, whether it's network adequacy or the essential health benefits, or the way some of the open enrollment or special enrollment triggers are carried out. But I think another important thing we heard today that advocates can work on is the need for transparency, helping patients with limited health literacy understand their benefits and how to think about deductibles and co-pays and accessing doctors' primary care versus emergency room use. And better transparency during plan selection. How do I know whether or not my drug is covered? How do I know whether or not my doctor, my radiologist, my lab are in network? Because all of these things have sometimes significant health cost implications for patients and may mean they cannot get the care they need. But right now, I think everyone agreed it's really hard for patients to figure out if their plan covers what they need.